Hello and welcome to HSM 410. For today's class, we'll be discussing patient engagement and evidence-based practice. So there are three learning objectives for today's class. The first is that by the end of the class, you'll be able to discuss the concepts of health literacy and information literacy. You should also be able to discuss the use of telehealth as a tool for engaging patients, and then be able to discuss what evidence-based practice is and how research findings can be introduced into practice. So we're going to start with the first learning objectives where we're going to talk about health and information literacy. So when it comes to especially to the 21st century, there's a lot of information that is available online over the internet. Patients or people generally go online to go and find out information about what's going on with their health, what's going on with the health of their family. So there's a lot of information that is going on. There's a lot of patients, health consumers are seeking information online. Um, and as healthcare professionals, we kind of have the need to go to where the patients are so that when they're looking for the information, we can be there to know what information that they're looking for and be able to provide them with the correct information that they need. And this is so much more relevant today because there's a lot of with more and more people using technology, more health consumers are embracing electronic technologies as a way of interacting with healthcare providers or healthcare service. So a lot of that can happen over at patient portal, and patient portals like the electronic health records or the electronic medical records are places where you have a lot of current and health statuses in there. I moved to the US in 2018, and my charts, which is still the same health electronic health record that I use, has been was the one that was used by my former hospital and my the present hospital that I am in. So basically, through my charts, I can give you my medical history from 2018 till date. So, and that's because there's a lot of information that electronic health or patient portals are offering, and this includes lab results. This includes a lot of communications that I can have with my health providers. A lot of that information is in there. There's also a lot of health information that it goes on through social media interaction. Um, you have the health blogs, but you also have people who, do newsletters as well. You have podcasts as well. I think I shared with you guys a couple of health informatics podcasts as well. There's a lot of health information that is going on through social media. You have a number of Facebook groups whereby you have people who have a kind of similar health experience going there, and they talk about what's going on with them. So there's a lot of information going on with there's a lot of consumer information happening on social media. And then you have the health related games as well. You have simulation games. I'm currently using one for a research that looks at social determinants of health simulation. And in that game, you kind of see the person in the game having to navigate their regular life and how that affects their health outcome and how they're interacting with the healthcare system as a result. So there's a lot of health related games. There's also a lot on nutrition. There's some games that helps people who use that to plan their meals, kind of pay attention to what that's going on. So there's a lot of information, health information that happens with health related things. And then, of course, we know about the wearable technology. I've talked a lot about it, the Apple Watch and stuff. So there's a lot of information going on, and that includes other health apps. And then you have the remote monitoring and telehealth as well. And then we have Dr. Google, and the idea of Dr. Google actually came a while ago because you had a lot of people who would just go to Google to find information rather than ask a health professional. For one reason is because before you get to meet a health professional, there are a couple of barriers that come in with meeting a health professional. You have whether there's you're able to schedule an appointment and then having to drive yourself to the appointment and doing all of that. So going to Google and just typing in your question is a much relatively easy way of getting trying to figure out what happens. So initially you had a lot of health professionals, especially clinicians and physicians, who were kind of kicking against the practice of patients just going into Google and self-diagnosing themselves. But with time, this been kind of an embracing of the fact that patients will go to Google, regardless of how individual physicians may not like that this is happening. Just because they don't like it doesn't mean it's not happening. So this is where you have some health professionals embracing Google and in trying to use that. So you can click on this. It kind of takes you through a research that looks at how health professionals are kind of integrating with Google and trying to figure out how to provide people with accurate medical information as much as possible. So the reason why it's important, the reason why we need to pay attention to consumer information and where consumers are getting their information from is because when we have a more informed patients, we have better health outcome for the patients, and that's because they are paying much closer attention to their overall health, or even changes in their health, and they, as a result, do much better with their health outcomes than patients who are, a little less well informed. So, what's happening with healthcare, or has always happened, at least to a degree, is that health provision does rely quite a lot on patients' ability to understand and follow directions. I mean, once you go and visit your healthcare provider, you go home. They're not going to go home with you. They're not going to have you, know what medication that you're taking, if you're taking it correctly or you're not taking it correctly. A lot of that leads with the provider's assumption that the patient that they just saw is going to be able to go home and be able to handle the medical advice that they've given the patients and be able to kind of integrate all of that in advice into their regular life. Let's use, for example, if your medical provider gives you a medication and says you need to take it in the morning with meal, they tell you this, take your medication with food, but you may not have the time all the time to eat before you in the mornings, for an example. And then let's say you're somebody who sometimes forgets to eat breakfast. You may end up taking the medication at a different time than they think that you should, or they prefer for you to take that medication. So there's a lot of what's happening in healthcare, people managing their health, that is happening outside the control of health care providers, which means that the healthcare providers are working with the assumption, which may be erroneous sometimes, that the patients that they have given this medical advice to is able to interpret the advice they've given them, and should anything change with their health, that they're able to seek help early enough in a way that can help them, stop things from going badly. So just because an information was provided or information was available doesn't mean that the patients are going to participate in it or that they would even understand it. They could take a completely different interpretation from the advice that you gave, from what you think it is that you're saying. And this is something that happens a lot with communication, whereby what somebody says, not always what the other person understood. And this can happen with health, especially because the healthcare provider is very knowledgeable, is very much trained, and is speaking to someone who is considerably less knowledgeable or considerably less trained. So that can create a kind of a gap between what the healthcare professional says, thinks that the patient is understanding from what the things that they've said versus what the patient actually did understand. So this is where health literacy comes into play. So health literacy has been defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information, your services, and in order to make appropriate health decision. A lot of what comes into play when we're talking about this ability to obtain, process, and understand is you want to think about the patient's educational level. What is it? How much do they understand what it is? Just the basic language. Generally, for health literacy, the advice is that you keep your health information, especially the one that goes to the general population, you keep it at a grade 6 level of education of language. But the thing is, we're making the assumption that sixth grade level of language is standard, is standardized, but we know that it's not, based on the US education system, that some areas have much poorer education than other people. So just because someone is in sixth grade does not necessarily mean that they are operating at a sixth grade level of learning and stuff like that. So that comes into play. And of course, you have to also consider people who have English as a second language as well, and whether people also what are dealing with, familiar with some health terms, and they're able to kind of make sense of it. Another thing, definition for health literacy is that it's the ability to negotiate healthcare environments and understand the economics of payment of services. And as an immigrant in the US, I'm going to tell you that the US health financing is very, very, very complicated. And when I moved to the US initially, I could not make sense of how paying for services work. The whole idea of co-payment and co-insurance was just too complicated for me. And I am, quite relatively well educated, and I felt like a novice, like I didn't understand how money works as it relates to health financing. So imagine what that is to someone who is a little less educated or who is not very familiar with the financing part of it. They may rely on the insurance company to decide what it is that they're spending, and they may end up spending far more money than they should. So this is where health literacy does come in. So we have the health literacy umbrella that kind of looks in all the things that come into play with health literacy. So you see the health problems and risks that are coming in like a rain, and you have all the other things that kind of help prevent the rain from getting to the person, and therefore them being able to have better health. You have values and preferences. There are certain people that kind of take the word of healthcare professionals as Bible in terms of this is the truth and whole truth and nothing but the truth. And then there are people who are a little less trustful of healthcare professionals and kind of feels that when the healthcare professional says one thing, they kind of have to confirm it from other people before they, accept what it is that they're saying. So those are the things that come in. You have plain language being one of the factors that does come into play with health literacy. You have information technology, being able to use technological services, of being able to navigate technological applications, and then having peer support, having resources, and having health, having education. So all of this, a person who has all of this or most of it is able to build relationship with healthcare providers, is able to ensure that they follow up on health appointments, and they understand the information that the health professionals are telling them, and they're able to partner more with healthcare provider and the healthcare system, so that this way they are more informed patients. But of course, everybody doesn't have this, but just as important to know that this is all the things that come into when we're thinking about health literacy. So there are four types of health literacy. We have visual literacy, being able to understand graphs and other visual information. Computer literacy, being able to operate computers or any technological device. Information literacy, being able to obtain and apply relevant information. We're going to talk about computer literacy in a bit. And numerical or computational literacy, being able to calculate and reason numerically. So there are a couple of ways to promote health literacy, and a lot of that, at least especially with in the age of the era that we are in, is that you have to have healthcare professionals that embrace the internet as a source of information. Knowing that a lot of patients go to the internet for their information, and so we have to use the internet for health patient education and as a way to promote health literacy. And this is because patients are increasingly relying on the internet for instance information. So we have to kind of do that. Another thing to do is to be cognizant of the age of the people that we are providing the health education to, knowing that you kind of have to tailor a lot of the information to the target audience. For instance, when it comes to promoting health literacy to school age children, there's a couple of special challenges that they go through. First of all, whether they understand, knowing that children are still kind of finding they still have some kind of cognitive limitations, as well as some level of language limitations. So having to put that all into consideration, and also knowing that you kind of have to be extra engaging with them, otherwise they're going to lose attention and therefore they're not going to gain anything. So this is one of the challenges that come in with school age children, but also is something to pay attention to different demographic of people that you're targeting your health education for, knowing that they have some specific needs that you have to kind of acknowledge. So with school age children, you have these e-health programs that have been designed with the mindsets that the population that this education program is going to go to are highly connected, and they are very highly computer literate, and you want to make sure that you're kind of operating at that level. And then there are a number of free education, health education apps that you can click in case you're curious about it, to kind of show you how different health education has been used in different populations. So what is health information literacy? Information literacy basically deals with understanding, finding, evaluating, and using health information. And it's very important to do that because it plays into, you have to kind of consider a fluency in information technology, and having ability to do sound investigation using investigative methods, but also being able to apply critical reasoning and discernment. So as you can imagine, information literacy is a bit on a higher level than health literacy, because in this case, you're having to actually investigate, you're finding, you're understanding, evaluating health information. So it's happening at a much higher level. So information literacy is important, especially as healthcare professionals, because we use it to initiate, sustain, and extend lifelong learning through abilities and we do that through technologies. So the ability to locate, evaluate, and use health information is very important, and especially it's something that is quite urgent in the computer era that we are in, the digital health era that we are in. It's something that one cannot do without. So information literacy and some informatics tools does give healthcare professionals critical skills that they can use, as this way they are increasing health efficiency, healthcare efficiency. They're more effective, and there's a lot more patient safety that is built into the informatics tools. And being information literate can make a difference between one healthcare professional and another, especially when it comes to providing evidence-based care or applying evidence-based care when it comes to healthcare delivery. So that's where we end for the first learning objective. Just watch the next video for the second learning objectives, where we are going to discuss patient engagement. You have a lovely day. Bye.